Hi, my name is Jose. I'm gonna be doing an assessment on you today. First things first, I'm gonna wash my hands. As I'm washing my hands, I'm visualizing my patient to see if he's in distress, as well as checking the environment for any safety hazards. I'm also gonna gather my equipment. I'm gonna wipe down my equipment with an alcohol just so it can be clean for the patient. Now I'm gonna identify my patient with two identifiers. Can you tell me your first and last name
Yes, Josier Torres,
and date of birth?
12/19/92.
I'm matching with the ID band just to see that that's his name and that's his date of birth. Okay, first thing I'm gonna do today, I'm gonna do a cardiorespiratory assessment. It should take approximately 10 minutes to do. First thing I want to ask, are you having any chest pain today or any shortness of breath?
Not today.
Okay. Now, I'm going to start my assessment first by just looking at your chest wall, okay? So I want you to just breathe normal,
Okay.
and I'm going to count your respirations for over a minute.
Okay.
So as I'm looking at his chest wall, I see his chest rise. Chest wall is symmetrical. I see no flail chest noted. Respirations are even and unlabored. And as I count over 1 minute, respirations are 16. So now I'm going to auscultate your breath sounds, okay? First thing I'm gonna do is I'm gonna inspect your neck to see if you have any neck vein distension. So I want you to look that way and then look the other way. No neck vein distension noted. Now I'm gonna auscultate the brachial breath sounds. So I'm gonna place the diaphragm over your trachea, so tilt your head up and take a deep breath. Hold it. Now you can breathe. Good. Take a deep breath. Good. One more deep breath. Good. Now I'm going to be listening to the bronchial vesicular breath sounds. Take a deep breath. Good. And deep breath. And good. All right. Now we'll be listening to the vesicular breath sounds. Take a deep breath. And one more deep breath. Very good. And two more. Go ahead. And go ahead. Very good. No adventitious lung sounds noted, such as rhonchi, wheezing, or crackles. So now that I've assessed your respiratory system, I'm going to be doing your pulses. So I want you to stick your arms out, and I actually have to feel your brachial pulse. Brachial pulses are palpable and strong, +2, normal. Now I'm gonna feel your radial pulses. Radial pulses are strong and palpable, +2, normal. Good. And now I'm going to be inspecting your lower extremities for any pitting edema, as well as checking your post-tibial and dorsalis pedis pulses. So as I inspect his feet, I'm going to assess for any pitting edema. I'm going to press down. Does that hurt?
No.
No pitting edema on the left lower extremity. And go ahead. Does that hurt?
No.
No pitting edema noted on the right extremity. Now I'm going to be palpating both post-tibial pulses. Okay. +2 normal post-tibial pulses noted. And now I'm going to be doing the dorsalis pedis pulses at the same time. dorsalis pedis pulsus present, +2 normal palpable. Now I'm gonna wash my hands again before I start my cardiovascular assessment. I'm gonna grab my stethoscope. I'm gonna listen to your heart valves, okay? So first I'm gonna place my stethoscope on the second intercostal space next to the sternum, and that's gonna be the aortic valve. Now it's gonna be the second intercostal space to his left, and that's gonna be his pulmonary valve. Very good. Now then the third intercostal space is Erb's point, and there you would use the bell to check for any pericardial friction rub. No pericardial friction rub noted. Now I'm gonna place my diaphragm over the fourth intercostal space to listen to its tricuspid valve. Good. Now I'm gonna listen to his mitral valve, which is the fifth intercostal space, mid-clavicular line, which is also known as the apex of the heart. No extra heart sounds were noticed, such as S3 and S4, which are the ventricular and atrial gallop heart sounds. Do you have any family history of heart disease?
I do.
You do? Or do you know any of them? Did they have any high blood pressure or cholesterol problems?
Mm-hmm.
Which ones? Both?
Just on my dad's side.
What did they have? Do you know? They had cholesterol problems?
My grandfather died of a heart stroke or
heart attack? Okay.
Yeah. And my dad struggles with high blood pressure.
All right, sounds good. Now I want you to sit on the edge of the bed. All right, good. I'm gonna put my palms right here over your chest area, and I want you to say 99.
99?
Okay, good. Say it again.
99.
All right, good. No tactile firmness is noted. Now I want you to stand, and I want you to come over here, and we're gonna do the same thing, but on your back. Go ahead. Say 99.
99.
Okay.
99.
All right, good. Now I'm gonna do the posterior breath sounds. So the bronchial is always gonna be on the top portion. Take a deep breath. Good. Go ahead. Good. Now the bronchiovesicular. Very good. All right. Now it's going to be the vesicular breath sounds. And one more. All right, good. No adventitious breath sounds noted, such as crackles, wheezing, or rhonchi. Now, I want you to go ahead and take a seat at the edge of the bed. And I see that you have mentioned that you have family history of a heart attack, as well as your dad suffers from high blood pressure. I wanted to give you some education about coronary artery disease, which is heart disease, which your grandpa suffers, and such as your dad is suffering from high blood pressure. Some things that you can do for those is you can increase your vegetable intake to 2.5 to 3 cups a day, and then you would do half of that for the fruits, so 1.5 to 2 cups a day for fruits. On top of that, you can do daily exercise such as 30 minutes a day, and the best form of exercise is walking, so 30 minutes a day for walking is also good. Okay. All right. Also, I wanted to ask you, have you had any rash or any discharge in your breast area?
No.
No. All right. I'm also gonna teach you on how to perform your self breast exam. Okay.
Okay.
The best time to perform a self breast exam is when you're taking a shower. You want to put some shower gel over your hand, and you want to put that arm up. So go ahead and put that one arm up over your head.
Okay.
And I want you to feel all starting from your axilla, and you're gonna feel with your fingers, and you can do circular motion coming down to your nipple. And what you want to look for is for any lumps, anything that feels abnormal. Okay, and that you would do that at least once a month. Okay. As well as when you look at yourself in the mirror, you also want to see if there's any discoloration of your nipple or any abnormality going on with your breast. Okay.
Okay.
All right. Now I want you to go ahead and lay back. Okay. And thank you for allowing me to do my cardiorespiratory assessment on you today. I want to make sure that the patient has the call light with him at all times, and I want to put the bedside table next to him as well as his personal belongings as close as possible. And thank you once again, and I hope that you feel better. Okay.
Thank you so much.
No problem.
I appreciate it.